And then so outside of the world of peptides for a second.
Yeah.
I've got these 3 vials in my hand.
I'm so scared. All right.
Do you know what those are?
Oh, yeah. This is, unfortunately, our future if we're not careful.
Explain.
So, what we've got here is we have 3 different canisters containing water that has a little bit of coloring in it. And what you can see is that all the way back in 1973, this is pretty opaque, all right? Like, this is not what you can't see through it. And then 2026 has a little bit of color to it. And then we've got over here 2045, which is totally clear. This, unfortunately, is actually representing the fertility trajectory for young men, because what we're seeing is that back in 1973, total motile sperm count, so how many healthy swimming sperm do we have in each ejaculation, is exponentially higher and more dense than what we're seeing today. And so what we're seeing is a progressive decline in male fertility over time. And that's been demonstrated in multiple studies. We've debated this at multiple meetings. People have tried to argue that it's a measuring difference. But as we give it more time and as we give it more scrutiny, this is real. We are experiencing a significant decline in sperm quality and motility and concentration.
Why?
So the leading culprits are going to be, yes, microplastics and environmental toxins, okay? Things that are put in our environment that we have been exposed to that we can't help. But again, the biggest modifiable risk factor is insulin resistance and metabolic disease.
Obesity.
Obesity. And so a downstream effect that we may see from peptides, like we discussed before, is we may be able to help reverse this for the first time in history by trying to prevent the development of metabolic disease.
Using some of the peptides we talked about earlier.
Exactly. I gave you the example of a patient that I saw in clinic this past week that increased his sperm count 10 times over. Imagine if we had given that to him before he even got that obese, when he just started to get a little bit overweight and at a lower dose. Well, he may have never ended up in my office, right? Because his primary care doctor would have identified that, treated it, and he never would have needed the specialist.
It's crazy.
It's wild. So ultimately, if you look at what are the ills that are affecting healthcare in, any first world nation, the number one offender is metabolic disease and metabolic dysfunction. And this is something that was actually hinted at, by, RFK whenever he was talking about root cause of disease. Well, yes, we have many, many diseases and many, many infections that don't stem necessarily from insulin resistance. But if we look at cardiac disease, if we look at issues with lack of perfusion, my specialty, erectile dysfunction, right? We look at cancer. All of this is related back to obesity and metabolic dysfunction. And so if we can eliminate that, as a society, or we can minimize it to as little as possible, well, maybe I'd finally work myself out of a job.
Your specialty is erectile dysfunction.
Yeah, so my specialty is this branch off of urology that we broadly call men's health, okay? And so what that incorporates for us is going to be low testosterone, advanced hormone management. I take that a little bit further than most people. That's totally cool. And then also erectile dysfunction, Peyronie's disease, which is damage to the penis that causes curvature, and then male fertility on top of that. And I do a little other thing, treating leakage after prostate cancer treatment. And that's basically it. I treat like 5 things maybe, and that's it. So I'm very, very specialized because I was the kid that, liked to take my sandwiches apart and eat it one at a time. I was very precise. And I figured, you can do a lot of things in this world and be okay at them, or you can pick 4 or 5 and get pretty good at them. So that seemed to work for me.
I was looking at a photo of you 5 years ago and you were very different.
Yeah.
You've changed a lot.
So I will tell you this. Medical training in the United States has gotten better, but it is grueling. It's absolutely grueling. For 5 years, I worked anywhere from 80 to 100 hours a week in a hospital. No eating, very little sleep. Did not care for yourself at all. And again, we can argue whether or not that's necessary all day long. But the truth is that it really beat me down. It absolutely took me apart physically and psychologically. In part, it's designed to do that, because the idea is that as a surgeon, you have to be able to perform when all the lights are on, when everything is against you, you have to be the one to hold it together in the operating room and command that ship and save that patient. And I remember being totally devastated towards the end of training. And I did a very challenging surgery on a very needy patient. The gentleman was about to go into renal failure, did not have a lot of kidney left, and he had a very challenging kidney tumor that was in a very treacherous location. It was in a location where he should have lost that kidney by all measure if we were going to take out that cancer. And he was at a county hospital. He had no insurance, and we swung for the fences and did a very, very challenging operation on him. And against our best efforts with having everybody there, he ended up having a bleed postoperatively that night. And I remember getting the call, I was on call, and that his blood pressure had dropped and that he did not look well. And I knew exactly what it was because, again, this was a very treacherous surgery. And I went in the middle of the night with my attending, who was a different attending than the one I did the initial surgery with. And I remember just opening him up and just being covered in blood that we were taking out of the abdominal field, that we were evacuating, eventually identifying the area of the bleed. And there was no way that it could have been avoided. I remember my attending yelling at me, and we ultimately had to take that guy's kidney. And I remember walking out of there, just being totally shattered, covered in blood, crying in a hallway by myself, wondering if, what was the point? Like, is there a tomorrow after this? Like, I spent all this time in this training. Like, am I good enough? Am I going to be able to make this? And, I wasn't well put together, wasn't healthy. And I ended up spending a lot of time with that patient, literally held his hand throughout the rest of his hospital stay. And he ended up recovering and against all odds. But, afterwards, I took a strong interest in not only taking care of my patients, but also practicing what I preach, taking care of myself and prioritizing my own health. I got evaluated. I was diagnosed with low testosterone myself. Turns out not eating or sleeping for 5 years will do a number on you.
And cortisol stress.
Through the roof, 24/7. I cannot even imagine what, there's a part in the brain called the hippocampus that when they do MRIs on soldiers that come back from war, that'll be degenerated in them. I wonder if we did that in surgical trainees, what that would look like. But I made a commitment to take care of my patients, to take care of myself and make that a priority, and to be, simultaneously the best doctor and, the best father and, husband that I could be. Not perfect, made a lot of mistakes along the way. But, what you're seeing from 5 years ago is where I was, I've been in training now for 7 years, so it took a while to kind of recover from that. But what you're seeing is, what focusing on health and wellness can potentially look like.
The emotion in you is palpable when you talk about this. And I'm wondering where that comes from. What is it? Because you're looking off into the distance at something. And I don't know what you're looking at.
Yeah. I mean, when I'm caring for my patients and I see a young man that is struggling with his fertility and he wants to be a father, I was that guy. Me and my wife couldn't get pregnant when we first tried. We ended up having to do in vitro fertilization and IVF. I remember feeling like I wasn't a man because I was sitting in that room holding her hand and not having an answer as to why things weren't working. When I see my patients who come in that are, struggling because their hormones are out of whack, and no matter how they try to take care of themselves, something just isn't clicking. I've been that guy. And then when I see my other patients, that are further on in life and struggling with things like, prostate cancer or erectile dysfunction, whatever the case may be, I see my father, my uncle, my grandfather, and they are someone's father, grandfather, and uncle. Like, these are our brothers, and this is who I have been called to care for. And I care for my patients deeply. And it's because I care for my patients. And this is a calling for me that I care about stuff like this, because I want my patients to have every tool physically possible to live their best quality of life so that they can be whole and they can be happy, and so that they can be the best version of themselves for their loved ones.
Well, thank you for caring, because it matters. And a lot of this stuff is quite opaque and confusing to an average person like me. But I'm so glad that we have people out there in the world like you that are demystifying all of this for us and explaining it in simple terms, but also championing it. Because, one of the other things I've learned from doing this podcast is solutions to problems that a lot of people are suffering with are option right in front of us, but they need voices and educators like yourself out there leading the charge so that these types of things are available to everyone, not just the few.
Absolutely.
Not just the billionaires who can get whatever they want straight away any day.
Yeah, I mean, it's one thing I love is that I've been very blessed in my practice to take care of people that are much fancier than I am and sit in boardrooms and that sort of thing. But you know what? I love taking care of my regular patients who are, farmers, iron workers, tradesmen, guys that, truthfully, I have more in common with than anyone else. I joke with my patients, I'm just an overeducated plumber at the end of the day, right? Urologist. And so it's health is for everyone, not just for the fortunate.
The last thing I wanted to talk to you about is linked but random.
Yes.
It's the enhanced games.
Let's do it. I am so excited about these. So
do you know them?
I do very well. So for those of you, or for those who may not know, the Enhanced Games is a project based off of the World Anti-Doping Agency's own data. Potentially up to 40% of athletes that are competing at the Olympic level are currently using or have used banned substances at some point in time. All right. And also, we know that a lot of the compounds that are used for enhancement maybe aren't quite so dangerous if they're being administered by a trained medical professional with proper oversight. And as of right now, that's not happening. Also, at the same time, we know that Olympic athletes aren't paid enough, right? These are the best of the best of the best, and they're not even making the poverty line a lot of years. And so the idea is this: well, what if we go ahead and we strip away those rules, okay? We allow athletes to use medications that can enhance performance. We watch them very closely, and we have a team of doctors and medical professionals watching them. And then let's see what they can do at these traditional Olympic events and see if they smash world records. Oh, and they're going to give $250,000 to any first place winners and $1 million to anyone that hits a world record.
And just for comparison, how much are Olympic athletes getting paid?
They don't get paid to compete at all, okay? So they don't get paid to be an Olympic athlete. They end up getting sponsorship deals, and that's potentially the money that they can make. So, yeah.
Interesting.
Yeah.
So it's basically the doping Olympics where everyone's allowed to dope.
That's the idea. There are some caveats in there. They're trying to say that only FDA-approved medications can be used. Okay, so you couldn't use something like trenbolone, which is for veterinary use only, or theoretically any of the compounds we've talked about today because they're not FDA-approved. But also at the same time, they've said that they're not going to test for those things. And one of their athletes, Magnuson, has openly admitted to taking BPC 157 and that sort of thing. So I think we can kind of figure out that it may just be a wide open playing field, maybe. So.
The International Olympic Committee does not pay athletes a single cent for winning a gold medal.
Yep.
Just crazy.
How many billions do you think they make off of those with all the advertisement?
So much money.
Right? Yeah.
And this is taking place in Las Vegas.
May 21st through the 24th, I believe.
Are you going to go?
I'm going to be watching, that's for sure.
Do you want to go?
I would love to go. That would be incredible.
Well, if you want to go, I know a few people that are putting the event on, so do let me know.
I'm there, man. I'm already interested. You got my attention.
Is there anything else we should have talked about that we didn't talk about as it relates to this subject we've discussed today?
I mean, honestly, I think that we've gone pretty deep on peptides. And so I think we've, covered that. But one thing that I did want to just leave with you, because I think it's pretty humorous, and I think you've talked to some of my colleagues about this before, but, one of the things that I deal with as a surgical specialist is the end stage of vascular disease, the end stage of diabetes, which is going to be erectile dysfunction, all right? And, believe it or not, whenever we're dealing with that in male patients, they eventually get to a point where things like Viagra and Cialis do not work, all right? And that is a dark place to be as a guy. And so you're taking these medications, all you're getting is a headache and nothing else. And then maybe you have other options. There are actually injections you can do into the penis, which is about as appetizing as you might imagine. But men want a better solution, and they'll come to us as sexual medicine specialists, seeking that. And that's what I do. So the bulk of my surgical practice is actually fixing erectile dysfunction with a procedure called implant placement. Okay.
Oh no.
Absolutely. So now, I think, did Rena show you one of these last time?
She brought it and I didn't ask her to
You
show me. It makes me like, I get full body shudders when I hear about this stuff. Yeah. The thought of putting that up my penis.
Well, so
you can show me. No, you can show me.
Well, I would tell you, the good news is you don't have to, okay? Like that's what we have a job for, okay? But the way I explain it to patients is like this. So take this out of the picture, okay? Ultimately, like the male erection is just two inflatable tubes that start in the pelvis and go out the shaft of the penis. It makes sense, right? It is a hydraulic motion. What happens is you get stimulated, get a rush of blood into those tubes, get a rigid erection, able to use that for intimacy, and then when you climax, pop-off valve opens back up and everything drains out, all right? So if you can understand brakes on a car, you can understand erections. But the problem is that when you have long-term metabolic and vascular dysfunction, the brake lines, the blood vessels that feed those erections, they fail. And all of a sudden, you can't get enough blood flow for it to work. And believe it or not, you can actually get atrophy of the penis over time and you actually lose size, all right? Which no man is eager to see, all right? But whenever the easy things like oral medications, Viagra and Cialis don't work anymore, the next best option, if we're looking at patient satisfaction, durability, concealability, is this little thing that I do, which is what if we took our own tubes, okay, and we put them inside your body's natural ones. It's invisible. Nobody looking at you could ever tell that you've ever had anything done. But all of a sudden, when you want to get an erection, instead of having to rely on pills that don't work or putting a needle in there, right, you could reach down and there's a small pump that we hide underneath the skin down in the scrotum. Okay, so I joke it's like a third testicle, but again, nothing external, nothing you can see. And all of a sudden, whenever you squeeze this, what it does is it moves saline that we hide in a little reservoir that goes in the belly, you never feel that, into the cylinders. And all of a sudden, men are able to get a firm, rigid erection that looks natural, feels natural, and they can use it as long as they want or until their partner's sick of them, and then press a button and it goes back down.
Do they still feel the same pleasure?
Yeah, so it does not affect sensation. And so the nerves that affect sensation run along the top of the penis, if you're looking at a clock, at the 12 o'clock position, and we stay totally away from those.
So this is surgically put inside the penis?
All internal. And believe it or not, that takes me about 13 minutes to do.
How many people have these?
Well, I've put in about 11 or 1,200 personally, but
11 or 1,200?
Yeah.
Okay, so it's quite a lot of people. There'll be people listening now that have these.
Well, this is what's interesting. If you look at in the United States right now, okay, there are 30 million men with erectile dysfunction in the United States right now. That's more than the population of Australia. All right.
Oh, wow.
And if you look at statistics, the oral medications are going to fail in 15 to 40% of those men the first time they fail that. And so you're talking about millions and millions of men who aren't responding to oral medications and need a better option.
So where's the button to get rid of the erection?
You see those two little bars right there?
These two?
Yep. Go ahead and put your thumb on do that. And then squeeze from the end of the device back towards the pump.
So squeeze.
Yep. Right there. There you go. It's down. And then you would have the weight of your natural tissue push things down.
Okay, and then okay.
And there you go.
Okay. Okay. Well, I'm happy people have the options because I can imagine what that would be like to not be able to get an erection. It would be devastating, frankly.
Well, I'll tell you this. I get more hugs and high fives than anybody else in my practice, and that includes the guys that treat kidney stones and cancer. So I feel like you're doing some good work here until peptides put me out of business.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.